there's a lot of variations in diagnosis of RA. And sometimes I even just take a huge step back and say, if you have joint pain, the Paddison program is probably going to work for you. And I've shared this in a lot of talks. I've used the Paddison program myself for post-inflammatory arthritis, and it worked wonderful. So you don't necessarily have to have a diagnosis of RA to benefit from the program. But anyway, carrying on with the rest of the question, strictly follow the Paddison program for 2 months, including 5 days per week gym. And what you can tell, you have very little stress. Wonderful. Since starting the program, you felt improvements in the range of motion of the fingers, but they are still very sensitive to the touch. Therefore, there's some questions. So let's get on to those questions. Question number 1, is it normal for joints to feel sensitive to the touch? Is this a sign of rheumatoid arthritis? They've been like this for months. Let's address that first question. Do you want to start or me?
I mean, the short answer is yes, isn't it? So we don't, like, if you were to touch, like, for example, your elbow, right? Mm-hmm. That doesn't hurt, and I'm hitting that pretty hard. But if I was to do that with some of my knuckles, I'd feel a bit fear to do so. So yes, because, and here's a subtlety. When I've, over the years, had some cortisone injections into my PIP joints, which have always been my, the photos you see of me in the past and everything, I show massive blown up fingers and stuff like that. And it's always been these same PIP joints. And when I've had injections into them, the ultrasound shows some osteophytes. So these are some bony spurs that occur in the actual PIP finger joints. Now, even if you've gotten rid of the inflammation, if you've got some little bony sharp things that are protruding off the bone, and then you tap onto someone's door, knock, 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 that can still feel tender. So it doesn't quite answer Marco's question there. But yes, a joint should not hurt to bump or to touch or to knock, and it should be cool to the touch. So I'll throw the ball back to you now to continue on the answering.
Yeah, I think you covered that well. I mean, it is not normal, quote unquote normal, for joints to hurt when you touch them. You should be able to have your joint in full extension and full flexion with no pain. Or if you're talking a wrist, full rotation, whatever the full range of motion for the joint is. Normal is that you can do all of those movements of the joint's greatest capacity with no pain. Same with touching. You should be able to completely squeeze, touch. I mean, within reason, we're not banging our hand against a door, but within reason of moderate touch that would occur in day-to-day life, you should not have pain. So anyone that has pain in a joint, whether that be movement or touching or temperature sensitivity or anything that is creating pain in the joint, that would be considered abnormal from a medical perspective. But is that a sign of RA? Not necessarily, but it's a sign that something is going on, whether that be something that's like inflammatory, related to the joint, related to the synovium, related to nerve endings. There's definitely something going on, especially when it's been going on for months. I mean, we've probably all had pins and needles or something from hanging your arm the wrong way that goes away temporarily. Something that's persisting for months definitely would attract attention and deserve some kind of workup, in my opinion.